Hey everyone, welcome back to the podcast. In today's episode, we get to join my colleague Matt Miller, who I've had the pleasure of working with for the last couple years. And while I don't always agree with his Patrick Mahomes versus Tom Brady comparisons, I'm excited to have him on the show. So, Matt, welcome to the show.
Cool. Thanks, Brian. Appreciate you having me on.
Absolutely, man. So I know we talk shop on a daily basis, and I think you're a really smart guy, and I think that you've had some unique experiences with the NFL Combine over the last couple years, and I would love to talk a little bit more about that today. But before we get started, for those that haven't met you before or are not familiar with your background, tell me a little bit about your current position and how you got into sports physical therapy in the first place.
Yeah, so I'm a performance physical therapist here at Irvine Orthopedic Sports Therapy, or IO. I've been a PT for about 6 years now. So I graduated from PT school in 2018. Always knew I wanted to work in sports. I mean, that was kind of the driving factor for what had me apply to PT school in the first place. I was an athlete my whole life growing up. Played football in college, and then I worked in collegiate strength and conditioning for a number of years prior to actually going into PT school. So I always knew I wanted to be in sports. And so this, the position that I have now allows me to work with that clientele. I feel very fortunate to do so. Just a little brief background. I graduated from Western University of Health Sciences in 2018 with my Doctor of Physical Therapy degree. In 2019, I completed a 9-month postgraduate intensive training program in proprioceptive neuromuscular facilitation over at the Kaiser Foundation Rehab Center up in Vallejo, California. And then at the end of 2020, I graduated from the accredited sports physical therapy residency at University of Florida. So, that was kind of all the steps along the way to get me to, the job that I have now.
That's awesome. And I think, just to dive in a little deeper, tell us a little bit about what your day to day looks like and the type of clients you treat and what your overall experience is day to day at IO.
Yeah, no, it's a very unique setup over here. So, I worked at a few different sports and orthopedic outpatient clinics since I've become a PT. But when you hear sports orthopedic outpatient setting, that doesn't necessarily mean you're only going to be seeing, highly active or, competitive athletes. So one of the things that's unique about IO is, I would say that without a doubt, we have, over 90% of our caseload is athletic populations. So ranging from, recreational, high school, collegiate, up to professional ranks. So we work with a very motivated population, people, that play sports and like to challenge their bodies. And so it's a very fun and exciting atmosphere here.
Awesome. Yeah. I think, one of the things that definitely makes our clinic unique is our relationship with the sports agency, right? And you've been a part now of the NFL draft classes for the last couple years. And I really want to dive in on that today because I think that's something that is unique. There's not too many facilities or PTs that are doing that. And you've been leading that combine now for the last couple years. I'd love if you could give us an overview of what that whole process is like of working with an NFL draft class and just kind of dive into some of that.
Yeah, so I feel super fortunate that I get to be a small part of that. We have a partnership with Excel Sports Management, formerly Rep One Football, but basically from the months of December spanning all the way through April, we help to serve and support an NFL draft class during their preparation. So basically, once they played their final collegiate game, they'll come out and do a host of what we call onboarding assessment testing. They'll work with us and the performance training staff that we have here, who works as representatives of Excel. We'll work together over the course of several months, going through Senior Bowl or East West Shrine Bowl, depending upon what avenue these athletes decide to go, through the NFL Combine, through their respective pro days, all the way out until the NFL Draft. And so there's it's a pretty unique and exciting time in our schedule. Very busy, but highly rewarding. And I feel super fortunate I get to be a small piece of that.
And for everyone listening to that, I will tell you right now, Matt is a little bit too humble. He runs this process from December through April every year, and there are so many things that go into it. He gave a nice overview of the whole process, but I'm gonna ask you to dig a little deeper in that because it's not an easy process. There's a lot of things that are going on throughout it, and I've seen the behind the scenes from day one of how much goes into that. And you mentioned onboarding. That's a pretty big piece of this puzzle of trying to help these athletes get from, hey, I just finished up a college football season. Now I have to go turn into a track athlete and
Right.
star
Yeah.
to run the 40-yard dash and jump as high as I can and be as physically fit as I can. That's a completely different change of process for them. And even this year, we had, how many UW guys that came out after their national championship game. So they had an even shorter window. Tell me about that athlete onboarding process and why that's so important in this process.
Yeah, so Brian touched on kind of a key piece there is we'll get these guys as soon as their season ends, and sometimes that's in December or like in the event of University of Washington, that was all the way in January, right? And so basically we'll get the guys in right away. We'll have them come in and perform a variety of different objective tests and measurements. We'll put them through a very comprehensive subjective examination. Basically trying to get a catalog of, what their injury history looks like, things that they've been dealing with along the way, what they feel is still a hindrance to them. And then the performance testing that we do, that consists of, motion capture, so movement analysis, handheld dynamometry testing, force plate testing, basic goniometry testing, looking at joint ranges of motion, and then all that data that we collect, basically we put that into what we call an athlete profile, and that tells us certain areas that they're within normative ranges for their position, and perhaps some areas that they fall outside of those normal ranges. And so, it's really important for us because not only does it serve to identify potential red flags, or maybe even something that's not quite as significant as that could be problematic down the road, and allows us to have some type of corrective intervention strategy at that point. But also, it gives us a nice baseline test for in the event that something unforeseen happens down the road. Perhaps they have some soft tissue issues. We have something for comparison there too. And then what we do is we take that information. You share that information with our performance training staff. That way, if they have to make any sort of, modifications to, make perhaps some of their auxiliary lifts, they can do so. And so that we can work together as a team to try to remedy whatever we identified as being problematic. And then we have a set date for retesting down the road to make sure that the interventions that we chose to try to address those issues were effective. And if not, then we got to go back to the drawing board at which time and say, okay, where was the breakdown here? And what can we do to help remedy that?
Yeah, so there's a lot involved with that, and can you maybe think of an example and talk to us a little bit about a time you've noticed maybe an athlete throughout this process, doesn't matter what year, that a red flag came up, the current injury was going on, and you had to help communicate that to both the athlete, the sports agent, as well as the performance staff to make changes at that initial process. What did that look like, and how did you start to deliver that information?
Yeah, we have some of those every year. So, we have some things that may not absolutely preclude someone from continuing to train. For example, we get someone coming in with a quadriceps or a patellar tendinopathy, and they have a pretty significant asymmetry with quad force output. That may limit their performance substantially. And then if we can start really targeting that to try to shore up some of those deficits, well, then oftentimes, their performance metrics start to improve too. On the other side of things, there are times where, there are injuries that they kind of need to be, they need to be taken away from some of the intense training here for a brief period of time after their season, focusing on rehab more than performance to try to get them, back to where they need to be, to where we can really push them with the necessary intensity to start prepping for the combine or the senior bowl or their pro day, whatever it may be. But basically, the conversation has to be had right away, like you said, with the athlete, with the performance team, with their agent, making sure that we get ahead of it, letting them know, hey, this is what we're seeing. This is what our concerns are. Perhaps even referring out to, an orthopedic surgeon or physician, for verification or for consultation. And then once that's been established, then we set up, whatever their appropriate plan is. And again, the goal is to get them, operating at a very, very high level for, them to put their talents on display for these NFL teams. But if there's something that is, if they're really at a high risk, then we have to kind of pull the reins back, say, okay, this period of time is going to be more of a rehab emphasis, and then we'll start getting them and, transitioning them over time over to more of a performance emphasis.
And talk a little bit more about why that's so important early on to do, because the draft process is short. It's typically 6 to 8 weeks, maybe 10 if we're lucky. But if someone's coming in and they got to dedicate a couple weeks or even maybe more to rehab something, how does that play a role with making decisions for draft stock and making decisions with pro days and things like that? Can you talk a little bit more about that?
Sure. Yeah. I mean, so the number one thing is we always want to, really do no harm, right? We want to make sure that we are keeping the athlete's health, at the forefront of our decision making. So if there's something that we see that we're like, ooh, we don't necessarily feel good about this, or this could really be an issue if we keep pushing this, that should send up a red flag right there, and everybody's got to have a conversation at that point in time. The other thing is, it gives the athlete and the agents the opportunity to kind of take a step back and say, okay, maybe our best strategy here is, for example, to, let's say, forego the Senior Bowl, make sure that you're ready for the Combine and Pro Day. And that's just one example. But it allows them to maybe make a modification to their strategy to make sure that they are going to be, again, showing their talents at the best of their ability when they have all those eyes in front of them. So, it's better sometimes to kind of pull the reins back early on, make sure we get, whatever the issue is remedied in as quick amount of time as possible. And then we start pushing, as opposed to just, continuing to push and kind of just hold our breath, because then what potentially could end up happening is they could perform very poorly, or in worst case scenario, have a significant injury. That's going to hurt their draft stock far worse than, maybe starting the process a little bit slower on the front end.
Absolutely. I know you mentioned earlier, there's different injuries that pop up or that they come in with. Let's say you mentioned patellar tendinopathy at one point. Can you maybe communicate to us and everyone listening, what that looks like if you got someone that, let's say, has a reactive tendon coming in on day one, you're going through your testing, maybe there's some things that pop up. Talk to me about maybe some things you would see on the athlete onboarding, and how you would make modifications to the weight room portion or the running portion to allow them to still train, but also make sure that you're being smart early on to get them closer to where they need to be.
Yeah, so I mean, tendinopathies are a big one, right? Because you figure they just had at least 12 weeks of, collegiate football. These are all high-level players, meaning they're logging a ton of snaps. They're probably not missing much time. So by the time you get them, I mean, sometimes they're in, not peak shape by any stretch. They've just kind of got their way to the finish line by kind of just toughing it out. And so, yeah, one of the things that we see oftentimes is they're super reactive, on that initial onboarding assessment. And oftentimes we'll see pretty sizable, asymmetries with force output there. So when you know that, we'll say, take quad, for example, when we know that they have this big quad deficit, well, we can pretty safely assume that when they're doing, heavy bilateral loading, or when they're doing, jumping, or any number of higher level tasks, there's probably a considerable amount of compensation. And so that's why we do a lot of these tests unilaterally, and we look at force plate metrics and things like that. But that's probably not the best time to just keep pushing and putting your eggs in that basket, right? So we have to figure out some strategies to get, that asymmetry shored up. And then once that is, within an acceptable range, well then, yeah, now we can push those things a little bit. So some tools that we often use long duration isometrics, any sort of like soft tissue mobilization, making sure that we're remedying any issues from a range of motion or flexibility standpoint that we ID on that initial testing. And then a big one is BFR, right? Trying to do, isolated unilateral training with blood flow restriction. That lower load typically is a little bit more tolerable, but we can still get a pretty strong strength stimulus for them. And then I think the key also is just education, making sure that everybody is understanding, this may not be a completely pain-free experience, this training process, but what's acceptable and what's not, right? So a lot of times we'll give them, and maybe it's more conservative on the front end, but we'll give them some type of numeric pain rating threshold to abide by to say, okay, anything up to this point, we're in the green. Anything beyond that, we're running a risk of becoming reactive again and then, kind of going back into that negative loop of having our force output go down and our symptom presentation go down. And so I think, just making sure that really good communication and incorporating some of those strategies early on. And then over time, they're going to be able to more than likely start to do more and more of the typical types of, pre-combine, pre-draft training that they expect.
And one of the things that I've noticed that you've done is you'll often go to the field with the performance coaches during their quote unquote run days and prep days, which is close by the facility. Tell me a little bit about what that looks like when you go to the field on those days, and how you're helping make adjustments on the fly, or maybe helping rehab, or making just decisions with the actual performance staff when players are out there.
Yeah, so we do a couple of different things when we're out there. In the event that, we have someone who is, transitioning kind of back to their more performance emphasis, oftentimes we will have come up with some predetermined, cutoffs from an intensity or volume standpoint. So sometimes we're there to support the performance staff and have those conversations. And also communicate with the player to say, like, hey, are you still feeling good? This is what we expected for today, but that doesn't necessarily mean that we have to hit that mark. And so, if they're, lacking confidence or they're starting to become symptomatic again, that way we can have those conversations right on the spot and make modifications accordingly. Hopefully everything just goes to plan. And, let's say, for example, they're going to do 75% of their, typical volume on that day. Well, then as soon as they hit the 75 mark, we're all good to go. We're going to go off to the side and finish up with something else. And then when somebody is just, unable to participate in any of the performance training at all, then they'll typically be off to the side, myself or with Brian, and we'll do some type of, alternative modified programming. Still working on, as much of the performance characteristics as we can, but we're obviously going to have to tone down the intensities, or maybe change certain ranges of motion, or different exercises that are going to be less apt to kind of aggravate them. So we'll have them off to the side. But also the nice thing is that they're still out there. So when the performance coaches are going over, technique or different footwork, for whether it's 40 starts or 3-cone drill, footwork technique, they can be there. They can walk through those, drills. And then when it comes time for, the higher intensity stuff, then they might come off to the side with us and do something different.
Awesome. So you go through this process. It's 6 to 8 weeks if you're lucky. There's that Senior Bowl right in the smack dab in the middle of it, right? Which always is fun and is
That's
easy to work around, right?
Side. Yeah, exactly.
Yeah. There's no bad things that ever happen from that, right?
Right.
Yeah. So the guys get through it somehow, right? You guys put it all together, and then it's the week of the NFL Combine.
Mm-hmm.
Okay, so you go out to the NFL Combine every year with the guys, and it's final preparations. Tell me about, what does the schedule look like for these athletes during that week? What does your schedule look like, and what actually goes on?
Yeah, you'll find out the schedule that day. So everything is subject to change and is dependent upon when they have their interviews with teams, how long their medical checks take, if there's NFLPA meetings that they have to attend, things like that. So, myself and then the performance coaches that attend the combine as well, we're just kind of on standby. So our phones are on and ready. We're constantly in communication with the athletes and the agents, trying to figure out, okay, When does somebody have a certain pocket of time that they can come back to the suite, get their rehab in, hop on any recovery modalities that they may need, and then when do we have time for them to go out with the performance coaches to continue to keep their training? Because just because they're out there in Indy, that doesn't mean that their training stops, right? So, typically they get out there a few days before their initial test date, so the performance coaches will take them through, continued warm-ups. They'll do a little bit of high-intensity work, a day or two before when they actually have the test to make sure that they're primed and ready to go. But the scheduling, it's always subject to change. So we just kind of go with the flow, and we always stay ready. But, those days, they're super fun. They're long. We'll typically up at 7, 8 in the morning. Oftentimes the guys will come in early to check their weight, because what you weigh in at the combine, that matters. So sometimes guys are trying to go up, sometimes guys are trying to go down, but we have a scale there in the suite, so they'll try to get their weights, see where they're at with that prior to the official weigh-in. And then we're seeing guys periodically throughout the day until 11 p.m., sometimes midnight. And it's certainly not busy all the time. There's a lot of downtime there too, but every day is different. But yes, we'll get a guy text us, hey, just finished medical checks. I have, an interview with the Titans at 2:00. Can I get some work in? We'll come back in. They may do, a little bit of a manual tune-up with me, do some type of, corrective exercise routine, and then they'll go with the performance coaches, head over to the convention center, and they may be working on, starts or flies. And so, it's a fun, exciting process, but every year is a little bit different, and you just kind of roll with it.
Nice. So you mentioned the suite, right? Can you tell me a little bit about, what's set up in the suite and what are you traveling with when you're going there? What are you taking with you?
Yeah, so the suite, it just every year just keeps getting better and better. It's a really, really nice setup. But basically, the Excel Sports Management, they get this ballroom set up. It's equipped with, Normatex, or any sort of, compression therapies. There's red light therapies. We have a number of, percussion tools like a Hypervolt or a Theragun. We have different sort of heating and cooling apparatuses like the Venom attachment from HyperRest. We have all these, any modality that you could think of, it's stocked and ready to go. We have a couple of bikes in there that are all set up. Myself, I bring a treatment table. So we have a really nice Nubis Pro inflatable table that I just wear it as a backpack and bring it in. Look it up. I'll bring, stuff for soft tissue mobilization. I'll bring a bunch of different tape, because oftentimes I'm taping there at the combine. To bring in, resistance bands. There's a number of, things that you would see in a PT clinic, but the stuff that's portable. And then the place is just stocked with every, healthy snack that you could possibly imagine. They do a really good job taking care of the athletes, and making sure that it's a nice home base for them, because this is like the most stressful week of their life. So anything that we can do collectively to make things just a little bit easier for them, it makes a world of difference. So, the athletes have their own hotel. It's literally right next door. But most of them use the suite as kind of their place to kind of decompress. So, they'll come back, they'll grab the meal. They may hop on some compression boosts, throw their headphones on. A lot of times they're watching film, because a lot of these, meetings that they have to go through with the teams are, they're going over the X's and O's. So it's just a nice little setup for them. And like I said, every year it seems to get better and better.
Nice. And do you have any access to watch the combine, or do you get to go to the field to see anything? Like, how does that work?
Yeah, so that's actually something that's, over the last few years, they've been allowing that, allowing people into the facility. So we can get pretty close. I think They allow spectators in both end zones and then up to maybe like the 10 or 15 yard line. So yeah, we can get pretty close and see the guys perform. And I like to try to do that as much as I can. We can't always make it out to the field because sometimes there's other guys that are needing treatment or needing to work on stuff. But yeah, it's awesome to be able to see them live and watch them put forth their everything that they've been working for to finally have their payoff day. So
That's awesome. That sounds like a pretty cool experience to be able to see the whole thing through the week of
yeah,
and kind of experience it from a different perspective as well.
absolutely.
What would you say is like the best part of the whole process? You've been doing it for a couple years now. You've been to the combine. You've helped guys get prepared for it. You're doing the onboarding. It's a 4 month grind with lots of laughs along the way. But what's the best part?
Yeah, I think just the relationships that you develop. I mean, it's always they bring in such great guys here, and you really get to you know be a small piece in their journey and just kind of watch them battle, for months. And then, when draft weekend comes and those guys hear their name called and you just see the elation on their face and their loved ones, it's just like it's such a great, you know, um, it's such a great feeling. And um, to reach out to them and congratulate them, and they're always so happy and appreciative. And it's a really unique, special experience and special time.
That's awesome, man. Sounds like a very cool experience. I think you did a great job summarizing it for people that haven't experienced that. And I think, there's not a lot of people that get to do that stuff. There's not a lot of sports PTs that get to work with a combine class or a draft class every year. So I appreciate you breaking it down and kind of giving us the ins and outs of what it looks like from start to finish, the fun parts of it, the stressful parts of it, the communication aspect, all that stuff. I think that's a pretty special experience.
Yeah, no, it absolutely is. It's one of my favorite times of the year. So
Good stuff. Well, to wrap this up, I have one final question for you. Hopefully, you answer this correctly. If Tom Brady were to come out of retirement right now and play again for, let's say, a quality team, and he goes up against your Patrick Mahomes and the Chiefs, who's winning that game in the Super Bowl?
well, I have so much respect for Tom and what he has, accomplished throughout the course of his career. And because of that, even in spite of the fact that he's 46 years old, I would put my money on Tom to beat 30 other quarterbacks in the National Football League, but he probably loses to Pat by at least 3 scores.
And this is what it's like every day in the clinic. Good stuff, Matt. Appreciate your time, man.
Thank you.
Thanks for coming on again, and we'll talk soon.
I appreciate you having me. Thanks.
See you.